Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
So thank you everybody again for joining us for the third and final installment of the High Risk and Breast Cancer series, and today's discussion focuses on nutrition. I'm Katie Armsby with Cancer Support Community Atlanta. If this is your first time joining us for Cancer Support Community Atlanta program, we welcome you and invite you to visit our website, cscatlanta.org, where you can see a complete list of the virtual and in-person programs that are led by professionals. We have support groups that meet virtually and in person. I do want to highlight we have a couple options for breast cancer support groups, and we also have a weekly support group as well. We have some great stress reduction classes like yoga and Tai Chi, nutrition seminars that happen monthly. We also have a newly diagnosed nutrition seminar that goes over eating and nutrition during treatment. So you're welcome to join that one. It's held virtually and in person and happens monthly. And then, of course, education programs like these. And like I said earlier, if you ever miss a live program, you can go to that website, cscatlanta.org, and click the video library tab where you can see past programs. I'm excited to welcome back Emily Beard. She's moderated all three of these series, and we've had some great conversation during the Q&A, so we're so happy to have her back. Emily Beard is the program coordinator overseeing breast cancer program development at Northside Hospital Cancer Institute. With a bachelor's degree in nursing from Emory and certification in oncology nursing and breast cancer care, Emily has worked as a nurse navigator, patient advocate, and program coordinator. She has a special interest in metastatic breast cancer and developing initiatives for young people with cancer, specifically in the areas of hereditary cancer, fertility preservation, and sexuality and intimacy. So with that, Emily, I will pass it off to you to begin today's presentation.
Thanks, Katie. It's a pleasure to be back. We have had just some great conversations and great engagement from our previous presenters. And again, I just wanted to make everyone, if you didn't catch those first two sessions, we will have those available on the Cancer Support Community website soon. So be on the lookout for those. So today is our final session, and we are so fortunate to have Savannah Duffy with us. Savannah has been a recent addition to our oncology team. She's been at Northside. Well, she's been at Northside since she was born. She was born at Northside. So from one Northside baby to the other, I was born probably decades before you were, but I'm also a Northside baby. So cheers to that. She graduated from the University of Georgia with a master's in food science in food and nutrition, and then came to Northside as a registered dietitian and nutritionist. And then in 2023, just earlier this year, she's joined us as part of our oncology team, and we're so thrilled to have her. One of the perks of our high-risk clinic that you heard about a few weeks ago when Kiana spoke was that Savannah is available as as in consultation. So when you physically come to the clinic, you have the opportunity to meet Savannah and have a consult with her as well. So in addition to your cancer risk assessment, you also get a chance to kind of talk about what you can do to reduce your risk with her in terms of nutrition and eating. So that's a perk that we're just super excited about. And we are so grateful to her for being willing to make that service available to our patients. So Savannah is currently working on additional credentials so that she'll be certified in oncology. And I have met lots of dietitians through the years, and the ones that really allow you to celebrate life with food are the ones I like the best. So I appreciate that Savannah is not somebody who's going to tell us what not to eat, but what we can eat and how we can do it safely. So without further ado, Savannah, I'm going to pass it on to you, and I look forward to doing some question and discussion at the end.
Perfect. Thank you so much, Emily. I didn't know you were a Northside baby as well.
I know. We just find these things out. I was like, oh, we have that in common.
I always love when I meet people and that's the case. Well, yes, I am so happy to be here today. I'm talking about my favorite topic in the world, which is nutrition, but specifically how we can reduce our risk of breast cancer through nutrition. So, like Emily was saying, this is the third part of this series. If you weren't able to catch the first two parts, in which Kiana Olson, our nurse practitioner of the high risk program, spoke about general high risk and breast cancer. And then last week, Tim, one of our genetic counselors, spoke about high risk and genetics. So we'll pull a little bit of that information into today's presentation, but we're mostly going to focus on that nutritional component. So today's objectives, there are three main objectives that I would like to cover and kind of give you guys the information about. The first is, what is the link between breast cancer and diet and lifestyle? So we'll look at some actual statistics of how the two are correlated. Then we're going to talk about the American Institute of Cancer Research's recommendations for cancer prevention. So that's really the heart of what we're going to talk about today. Some practical steps to reduce your risk of cancer or your risk of recurrence. And then lastly, we'll just talk briefly about the role a dietitian can play in your health journey, as well as how the high-risk program might benefit you if that's something that you're considering. And then, of course, at the end, we'll have plenty of time to answer your questions. I love that component of the cancer support community. I love the questions you guys bring. Just to continue the conversation and really ask things that maybe some of the peers on today's presentation are also thinking about. Okay, so the first thing I just want to mention is the distribution of cancer. So here I have a picture, a pie chart of the estimated percentages of causes for cancer. So in that red percentage of this pie chart, we have about 10 to 20% of cancers are attributed to either family history, your environment based on your family history, or your genetics. So this is kind of what Kiana was talking about in week one, and what we look at in the high risk program is your family history as well as your environment. So this typically accounts for 10 to 20% of cancers and indicates that if you have, these certain factors that we expect could be contributing to cancer risk, you do have some increase in cancer risk. And that purple sliver is the hereditary or the genetic component, and this accounts for about 5 to 10% of cancers, and this is what Tim was talking about in last week's session. But today, we're going to talk about that big yellow component, which is roughly 70% of cancers are sporadic, meaning that they either occur by chance or they are related to environmental factors. So those environmental factors include your nutrition, your diet, your exercise, and your lifestyle. So this is the general population cancer risk. So even if you're fairly low on the hereditary family history of cancer, this is a great, area to focus on to reduce other cancer risk. So the sporadic, you're not really sure why you got cancer, no one else in your family's gotten it. This is the kind of, this is what we can really focus on to reduce that risk. So I just want to look at a couple of statistics. I'm not going to give you too many. This won't be doom and gloom, I promise. But some statistics for increased risk of breast cancer. So internationally, about 18% of cancer cases are attributed to the combined effects of either excessive body weight, alcohol consumption, physical inactivity, and an unhealthy diet. So that's about 1 in 5 cancers is attributed to these lifestyle factors. And it's important to note that this does not include smoking, which we know tobacco use is a big contributor to cancer. It does not include skin cancers, so exposure to the sunlight. So almost 20% of cancer risk comes from these other diet and lifestyle factors. We also know that weight gain, especially after menopause, can increase breast cancer risk in postmenopausal women. So today we are going to talk a little bit about weight. We'll talk a little bit more about that in detail in a couple of minutes. And then, of course, other chronic diseases, which are often tied to nutrition, can increase your risk of breast cancer. Type 2 diabetes specifically has shown about 13 to 27% increased risk. So if you've had type 2 diabetes, or a slightly higher risk of breast cancer. So I also want to look at some statistics for decreased risk of cancer. So we know tons of research studies show that intentional weight loss may reduce cancer risk, especially for breast cancer. So this doesn't mean you have to lose all of your excessive body weight. Even just 5 to 10% of weight loss of your excessive body weight can help reduce cancer risk. We also know that women with the highest vegetable intake actually had a decreased breast cancer recurrence. So this is specifically talking about cancer survivors in the risk of cancer coming back later in life. In a similar vein, women who eat about 25 grams or more fiber each day have a lower risk of breast cancer. Again, we'll talk a little bit more about that, but fiber is super powerful in reducing our risk. Lastly, there are some guidelines put out by the American Cancer Society. They're very similar to the guidelines that we're going to be talking about today. They're just worded a little bit differently. But the reason I bring this up is because a research study showed that women who had the highest adherence to those American Cancer Society guidelines had a 22% decreased risk for breast cancer diagnosis. So that's a pretty significant decrease in risk, which is why we're so passionate about making sure that all of this nutrition knowledge is available to the public so everyone can help reduce their risk of breast cancer. Okay, so let's dive into those recommendations, those guidelines. So today's recommendations are coming from the American Institute for Cancer Research, which is affiliated with the World Cancer Fund, which funds research related to diet, physical activity, and lifestyle on both cancer incidence, cancer treatment, and cancer survival. So there's about 10 guidelines that we're going to go over. And so this is going to be a little bit of an introduction to those guidelines. If you're interested in reading more about this, the AICR.org is a great resource for you. It has all of these and then some additional information as well. Okay, so our very first recommendation, I mentioned this a second ago in the statistics, but it is to be a healthy body weight or to work towards a healthy body weight. This is incredibly important because we know that after not smoking, being a healthy body weight is the most important thing that you can do to prevent your cancer risk. In fact, overweight and obesity puts you at risk for about 13 different cancers, including breast cancer, specifically in women who are postmenopausal. Unfortunately, even though we know this information, about 40%, almost a half of Americans do fall into the obesity category. Back in 2014, when looking at the cancer incidence across the country, overweight and obesity accounted for almost 11% of cancer cases in women and almost 5% of cancer cases in men. The good news here is that weight loss, even that 5 to 10% I mentioned earlier, can actually decrease your risk of breast and endometrial cancers. So this is really wonderful research that shows, if you were a higher body weight at one point and you were able to pull that weight down, your risk of cancer goes down with it. So that's the good news. Now, weight is a very sensitive topic, and one thing that I prefer not to do is to focus so heavily on body weight. The great news is these other recommendations that we're about to go through that can help reduce cancer risk tend to also have a positive effect on your body weight. So if we focus on some of these other things, typically our weight kind of falls in line with our goals. But of course, this is very individualized, but just know that all of these other recommendations will hopefully help with your weight goals if you do have a weight loss goal. So our second recommendation is to be physically active. So we know that physical activity is actually linked to a lower risk of breast, prostate, and colorectal cancers. And this is independent of your body weight. So even if you have a higher body weight, being physically active can help further your cancer risk reduction. A disclaimer here, you always want to talk to your physician before starting an exercise program, specifically if you recently had a surgery or you have been through cancer treatment, you have prior injury, or if there's some other condition that you're aware of. It's always great to check with your physician prior. Being physically active helps with so many different things. The biggest just being our quality of life. It achieves this by helping improve our muscle strength, our flexibility. It helps fight fatigue. It improves mood and thinking. It helps us sleep better at night. It actually helps us burn more calories for our weight loss goals, while at the same time decreasing inflammation in the body, as well as decreasing certain hormones that could produce or could promote cancer, such as estrogen, which we know, especially in Kiana's presentation, estrogen is linked to breast cancer. So the AICR gives us some guidelines of how much physical activity we should strive for. It tells us that we should aim for 150 to 300 minutes per week of moderate physical activity, or 75 minutes a week of vigorous physical activity. So that moderate, that could break it down into about 5 days a week, 30 minutes of activity, including brisk walking, water aerobics, playing doubles tennis. They do put pickleball in this category. I know pickleball is getting more and more popular. And then even things like yard work, such as pushing a lawnmower, that actually counts towards your physical activity as well. Now, the higher intensity physical activity is going to be things like jogging and running, singles tennis, basketball, swimming laps, etc. So this is just a couple of examples. Now, in addition to those, specific exercise times that we encourage you to implement into your week, it's also helpful to reduce sedentary time, essentially to walk more and sit less. So especially so many of us, myself included, have a desk job or we're sitting, looking at a screen so often. Our days are pretty sedentary. So incorporating some, opportunities to get up and to get moving, even if it's just taking the stairs, taking stretch breaks, combining social events with movement. So instead of going and meeting a friend for drinks or dinner, instead maybe you go hang out at the park or go for a walk. All of these activities can really help reduce your sedentary time. Okay, so this next recommendation is my personal favorite. And it says to incorporate plant foods in your diet, including whole grains, vegetables, fruits, and legumes. So I really love this recommendation because it focuses on an abundance mindset versus a restrictive mindset. Really, it's what can we add into our diet to help us to have the best quality of life and nutrition that we can. So all of these food groups that I just mentioned are chock full of phytonutrients. So those are the compounds in plants that gives them their color, their flavor, their aroma, and when we consume them, they also have protective effects in our body, including helping to fight cancer. The other benefit of plant foods is that they're full of fiber. And again, if you think back to that statistic that women who incorporate at least 25 grams of fiber each day into their diet have a lower risk of breast cancer. So incorporating each of these foods in your diet can help get your fiber goals up. They can also help with your weight goals because fiber is very satiated. So if you're filling up on these very satiating foods, you're less likely to then go a couple hours later and reach for the bag of chips or the cookies or the candies that might be tempting us. All right. On the opposite side of that, the next recommendation is to limit or avoid heavily processed foods that are high in fats, starches, or added sugars. So unfortunately, a Western diet, like the one that we consume here in the States, is associated with higher risk of cancer. And this diet is composed of those saturated fats, refined starches, and added sugars. So we really want to limit these foods and incorporate them in moderation and be really intentional when we are consuming them. Instead, it's best to have the majority of our foods being either those plant-based foods we mentioned a second ago, or healthy sources of fat, or lean sources of protein, etc. And again, following this recommendation can help with that healthy body weight as well. So our next recommendation is to limit consumption of red and processed meats. So red meat, which we associate with our beef, our pork, our lamb, that red meat like those are a probable carcinogen, meaning we've identified that it most likely increases cancer risk. Now, processed meats, on the other hand, like our bacon, our hot dogs, breakfast sausages, deli meats, these are a known carcinogen. So we recommend limiting or avoiding these altogether if possible, especially if you already know that you're at increased risk of cancer. So what we recommend is, again, avoiding altogether those processed meats and then limiting those red meat to about 2 to 3 servings per week, which is 12 to 18 ounces. If you can reduce your red meat even further, that's probably going to give you an additional benefit as well. Now, we also recommend limiting sugary sweetened beverages. So the reason for this is that sugary beverages like our sodas, many of our juices, a lot of our preferred coffee beverages, they increase our overall calorie intake. So sometimes you might hear the term empty calories. I really only like to use that when it comes to sugary beverages. You're not getting a lot of nutrition. You're also not getting a lot of hydration from sugary beverages. And instead, those extra calories can make it more difficult to either achieve a healthy weight or maintain a healthy body weight. Strong evidence indicates that the more sugary drinks we consume, the more likely we are to either gain weight or fall into an overweight or obese category. Instead, the best thing to drink is water or unsweetened beverages, particularly less caffeinated beverages, so that you're getting the full hydrating benefit of those drinks. On a similar note, the AICR also recommends limiting alcohol consumption. So unfortunately, we do know that alcohol consumption is associated with an increased risk of breast cancer as well as other cancers. So if you are going to drink, the AICR has put out this guideline that for women, we should consume no more than 1 drink per day, and men should consume no more than 2 drinks per day. Now, what this does not mean is 1 day a week women can have 7 drinks and men can have 14 drinks. That's not what it's saying. But it is saying that if you are going to drink in moderation, to just keep it to that 1 a day or less often if possible. The great news is that mocktails are becoming a lot more popular, especially with the rise of dry January in the last couple of years. So if you're interested in partaking in a beverage that tastes good but maybe is alcohol free, there are a lot more options available, a lot more recipe ideas that you can look into. Now, our next recommendation revolves around dietary supplements. So the ARSCR recommends that you do not use dietary supplements for the purpose of cancer prevention. So I'm going to explain this a little bit. So research tells us that 60 to 80% of cancer patients have taken dietary supplements either before, during, or after diagnosis and treatment. But what we do know is that our body prefers to consume dietary nutrients from our foods rather than from supplements. One, our body just absorbs this better from foods. But two, supplements are often mega dosed, meaning you are getting a very high percentage of your daily needs of that nutrient from the supplementation. And unfortunately, it's true that too much of a good thing can sometimes be a bad thing when it comes to supplements. Certain supplements, for example vitamin E, are actually associated with an increased risk of cancer because our body is getting it at such an unnatural and high amount. The other thing to mention is that supplements are not regulated by the FDA. So it's really the Wild West in the supplement industry. There's almost no guarantee that what they say is on the bottle is actually what's in it. And consumer reports are pretty alarming that, something like 80% of supplements on the market don't actually contain what they say that they contain in the same amounts that they're claiming their product contains. So we really want to be careful. We want to know what we're putting in our body, and that can be really challenging with supplements. Now, before you start taking supplements, check with your cancer team if you are someone who has been diagnosed with cancer or are a cancer survivor. Or you can also check with your primary care physician if you don't have a cancer team in place. Now, one thing I want to clarify about this is not to say that all dietary supplements are bad. There is a time and a place for supplement use. So what I mean by that is if you are going to the doctor and you're having your lab work checked or you're having a discussion with your doctor and they suspect that you're either at risk for deficiency or are deficient, or maybe you're taking a medication that affects nutrient absorption, in that case, it might be completely appropriate to take a dietary supplement. So I'm going to talk about 4 that are common that usually when I see my patients taking, the alarm bells are not going off. Typically I say, great, your doctor probably knows or recommended you're taking that, so keep on chugging along. The first one here is vitamin D. Now, many breast cancer patients, when they go in and they've been diagnosed with breast cancer, are actually found to be deficient in vitamin D. This is a little bit of a chicken and the egg situation where we're not 100% sure if vitamin D is increasing risk of breast cancer or the other way around. But either way, it's great to have this vitamin checked every year when you get your lab work done. And if you are deficient, you can go ahead and take a supplement. Another dietary supplement that can be really helpful is omega-3. This is because omega-3s are a kind of dietary fat that help reduce inflammation. They can also help reduce risk of cardiovascular disease. And if you are going through cancer treatment, they can reduce muscle wasting. Now, you can get omega-3s from certain food items, such as fatty fish. But if you know that the omega-3 foods you're not frequently eating, a supplement can be a great way to get this. Next, we have probiotics. So probiotics help to keep our gut microbiome nice and healthy, as well as improve our immune system. Usually, I don't see an issue when I see people taking probiotics. Now, I will say there are so many probiotics on the market, it can be helpful to talk to your doctor or your dietitian about which one is right for you. Lastly, calcium is a supplement that many doctors prescribe for their patients to help improve their bone health or their bone density status. Specifically, if you are taking certain hormone medications or have gone through certain cancer treatments, calcium can be really helpful to keep that bone density nice and strong. But again, if you want to be safe with any of these dietary supplements, always just check with your medical care team, and we can help make sure that you're getting the right ones at the right time. Those supplements that I would strongly encourage you to get a second opinion on are anything that is herbal, anything that is an antioxidant, for example, turmeric, that's a very popular one right now. Those are the supplements that I would encourage you to have more caution with. All right, so this next recommendation that's put out by the AICR is to breastfeed your baby if you can. So what we know is that breastfeeding can be beneficial for both the mother and the baby. We know that breastfeeding helps protect against breast cancer in the mother by lowering certain levels of some cancer-related hormones. And as a bonus, at the end of breastfeeding, the body actually gets rid of certain cells in the breast that have been damaged or have DNA damage. So it's really amazing how our body likes to work to help protect us from cancer. Now, this is also helpful for babies because babies who are breastfed have a lower risk of being overweight or obese later in life. And as we talked about earlier in the presentation, a higher BMI or being overweight or obese does increase the risk of cancer. So this is just one step that early on in your baby's life you can do to help protect them. Of course, I always like to mention, this recommendation is if you can. If this is appropriate for you, if your doctor is okay with you breastfeeding, if it works for your lifestyle, it does give some added benefit. But as a dietitian, hopefully your care team, if you're at the stage where you're having children and you're debating breastfeeding or not, I hope you know that there's never any shame in whichever you choose. Okay, so we have gone through the main AICR recommendations for cancer prevention. Now there is one more that I didn't include in this presentation, but I'd just like to mention briefly. And that is, if you are a cancer survivor, the AICR still recommends that you follow these recommendations to reduce risk of cancer recurrence. So hopefully, regardless of where you're at in your cancer journey, or if you're just looking to reduce risk altogether, these recommendations can be helpful. All right. So there are a couple of frequently asked questions I get asked all the time, so I just wanted to go ahead and address those for y'all today. The first question I get asked is, does sugar feed cancer? Which is usually followed by, do I need to cut out all carbohydrate foods? So what this is saying, so really it's a common belief or myth that white sugar feeds cancer. So what people have said or hypothesized is that our body uses glucose for energy. So glucose, or our blood sugar, feeds our cells and gives it energy. So what it's hypothesized is white sugar is digested more rapidly in our body. So they kind of said, well, maybe it's feeding our cancer cells more quickly. Unfortunately, or actually fortunately, especially for us sweet lovers, is that sugar does not actually feed cancer. Sugar in all of its forms, whether it's coming from white sugar or a starchy vegetable or a dairy product or a whole grain, it is our body's preferred source of energy. So all of those foods are digested and broken down into blood sugar that are then moved into our cells for energy. Now, we can't determine which cells this sugar is going to get. We can't determine if it's going to go to our healthy cells or our cancer cells. So that's when people start thinking, well, maybe I should just avoid all carbohydrates altogether. The problem is your body is still going to use sugar for energy. But how it gets that sugar at that point is, instead of getting it from healthy, nutritious foods, is it actually starts breaking down your muscle, leading to muscle wasting. and then it feeds your sugar with the glucose it gains from your muscles. So essentially, cutting out all of those healthy sugars, the carbohydrates, the whole grains, the starchy vegetables, not only are you depriving your body of that fiber we mentioned earlier, those phytonutrients, tons of vitamins and minerals, but you're also hurting your muscle in the process. Instead, the link between sugar and cancer is indirect. What we know is that too much white sugar or non-nutritive sugar adds too many calories to our diet, which in turn can cause us to gain weight and enter into that overweight and obesity status, which then increases our risk for cancer. So while it is a good idea to make sure you're not overdoing it in refined carbohydrates and added sugars, eating those things will not necessarily cause you to get cancer or lead you to an increased risk. But if you're eating those things excessively and your body weight starts to climb, that could then put you at risk for higher rates of cancer. All right, well, what about soy products? So soy, if you're not familiar, is actually a legume native to East Asia, and it is a high protein food choice. So some foods that contain soy are tofu, edamame, soy milk, anything derived from the soybean. So soy has several key nutrients and phytonutrients or phytochemicals that have been studied for their cancer prevention. What we know is that for breast cancer survivors, studies do not show any harmful interaction between soy foods and anti-estrogen medications. And some studies even suggest that there's some protection against breast cancer in individuals who consume soy products. So you might be thinking, well, okay, great, but I've heard that soy has estrogen in it, and too much estrogen can increase our risk of breast cancer. So in reality, soy has phytoestrogen. So these are basically mini estrogens, or a compound that looks like estrogen, but actually has different functions in our body and binds to different receptors than estrogen binds to in our body as well. So back in the 1980s, there was some research that came out that basically said because soy has phytoestrogens, you should avoid it completely because it will increase your risk of cancer. But since then, as research has evolved, we have found that that is not the case. At this time, soy is considered completely safe, and as these points that we just went over mentioned, it might even be protective against breast cancer. We don't have official recommendations for how many servings you should have of soy, but 1 to 2 servings per day does appear to be safe at this time. So that is the good news. All right. So now I just want to go over a couple of key points of how a dietitian can help you reduce your risk of cancer. So the first thing that we can do is help adapt all of these guidelines that we have just gone over into your daily life to help make it more of a habit and to help make it more sustainable for you to adopt these guidelines. We can also coordinate these guidelines and your particular nutritional needs with any other medical history you have, whether that's type 2 diabetes, or maybe you have a GI disorder, maybe you actually struggle digesting fiber. We can help you to adopt these principles while aligning them with your other medical history and nutritional needs. Dietitians can certainly help you reach a healthier body weight to reduce cancer risk. We can also help focus on ideal meal ideas and snack ideas, as well as recipe ideas, to incorporate more cancer-fighting foods into your diet. I also love helping patients navigate the use of those dietary supplements and help you understand all of the evolving nutrition research, or Dr. Google, as we know it as. When you get on the internet and you read something and you're not sure if it's true, you're not sure if you should apply certain strategies to your diet and lifestyle, we can help you kind of filter through that and figure out what's going to work best for you. Now, as Emily mentioned earlier, and as if you have been on the past two programs in the series, the Northside Hospital Cancer Institute does have the high risk program that can help you manage your breast cancer risk, or at least know what your breast cancer risk is, and then provide you with the resources and set you up with the care team to monitor your risk while also preventing it. So our high risk program includes our nurse practitioner, Kiana, who spoke 2 weeks ago, and she is wonderful and so dedicated to her patients in this program. The program also has genetic counselors like Tim, who you guys met last week. And then again, we can filter you out to different oncologists or surgeons for more enhanced follow-up if that's needed. And then lastly, if you do become a patient of the high-risk program, as Emily mentioned, we do offer sessions to work with myself so that we can help adapt all of these guidelines and help you further reduce the risk of cancer. So if you're interested in the high-risk program, if that is what brought you onto this series, feel free to contact us. Either email highriskcancer@northside.com or call this phone number that's on the screen, and we're happy to talk to you and see if bringing you into the high-risk program sounds like it would be beneficial. So we're really excited to be offering this, and hopefully, you feel really empowered after coming to the high-risk program. That is always our goal, is to make you feel as empowered about your health as possible. All right, we have a couple other additional resources. If you want to take a picture of the screen, or like Katie mentioned earlier, I believe these will be sent out to you in the recording. If you're interested in just nutritional counseling, feel free to reach out to Northside Hospital Nutrition Services. Their number is listed here. And then if you are interested in figuring out what your body weight is, or what your BMI is, so whether you fall into the overweight or obesity category, a BMI calculator can be a really helpful tool. And the EICR actually has one on their website. So, of course, like I mentioned, AICR.org is super helpful, but so is cancer.org, which is the American Cancer Society. Both have a ton of resources, some checklists towards helping you implement some of these strategies, as well as great visual aids. So those are really great websites I encourage you to check. All right, at this time, I'm going to have Emily come back on, and she is going to help moderate any questions that you all may have.
Can you see me?
Yes.
Okay. Thank you, Savannah. That was awesome. I knew it would be, and you covered so much, and I feel like I'm sure there's going to be questions, but I feel like you answered a lot of questions that I feel like come up typically. I just got one from one of our participants asking, when you juice vegetables and fruit, are you eliminating fiber? Like, is that what's the trade-off, I guess, with juicing, and how do you feel about juicing from a health standpoint?
Yeah, that's an excellent question. So yes, unfortunately, when you are juicing produce, you're usually losing like 99% of the fiber from those fruits and vegetables. So you are still getting a lot of the vitamins and minerals. You might not be getting 100% that was originally in that product, but you are still getting some vitamins and minerals and phytonutrients. So for you, if you really don't like eating fruits and vegetables, that could be a healthy tool towards getting some of those micronutrients in. But what I typically encourage is if you could turn your fruits and your veggies into a smoothie instead, you're actually going to retain more nutrients as well as fiber, and you have an opportunity to add some other foods like healthy fats or a protein source into that to make it more of a complete meal or snack. So that's really where I'm at with juices. For the most part, I encourage smoothies because you are losing quite a bit of nutritional value.
Thank you. That's helpful. I feel like that's one of those, a lot of people go out and get a juicer because it's like, oh, I want to have all this concentrated vitamin and mineral. But you're right. The actual fruit is what a lot of times is really what's good for you. So I just had one more question, and this is from somebody that I think I'm understanding the question right, but asking about processed food. So she says, I understand eating plant-based foods is important, but a lot of the plant-based foods are also processed. Things like the tofu, this is me just saying, but I think a lot of the vegetarian like patties and maybe some of the pre-made food that folks might use is processed. So sort of where do you find the balance with, wanting plant-based, but also, trying to go for something that's not so heavily processed?
Yes, this is an excellent question. So when we talk about incorporating plant foods, that does not necessarily mean you have to become a vegetarian or a vegan. Really what we're encouraging is choosing the majority of your foods being whole, minimally processed plant foods. So you can absolutely still have, meats in there. Again, we do recommend leaner meats as opposed to the red and processed meats. Or you can get your protein from plant sources. So things like your beans, your legumes, nuts and seeds, and those soy products. So this is where we get a little nitty gritty. So with soy products, there's things like tofu, soy milk, edamame. Those we consider less processed, and those are excellent choices. Those that are more heavily processed are the things like the fake chicken nuggets and the Beyond Burgers. Now that's where, to be honest, I would rather you have maybe like a high quality, low fat piece of red meat over that fake, heavily processed, faux meat product. The reason for that is that faux meat products can give you protein, but they also have a lot of filler ingredients, a lot of additives, and they're not going to give you, the phytonutrients and the fiber that maybe a whole plant food source of protein like beans would. So if you are trying to avoid red meat and you're going out to a burger joint and you have the choice between a black bean burger as an option or the Beyond Burger as an option, I would rather you maybe choose the black bean burger. That's not to say you can never have those faux meat products. I would just encourage that in moderation and to almost include those products into the processed foods category because they typically are also high in sodium. They might have added sugars to them, and they certainly, almost 100% of them have added saturated fats to them. So that's very wordy, but essentially, everything in moderation. If you like those products, great. If they help you get your protein in, great. Just make sure that the majority of your foods are still those whole plant foods.
Thank you. Yes, I'm a little guilty of the Beyond Burgers. I think they're delicious, but I may be in the minority there. But I just got another question from somebody who is asking about organic food, that she has read that organic food is healthier and wondering about whether I think we had also had this question earlier, just about whether there is any data showing that it's healthier or safer or reduces cancer risk in any way.
Mm-hmm. Yes, this is a good question as well. So I'm going to assume you're talking about organic produce because when we talk about organic product, a candy bar can be labeled organic, and we know that candy bar is still not necessarily healthy because it's really just sugar and fats. Even though it's organically grown sugar and fats, it still is doing the same thing in our body as, a Reese's peanut butter or Kit Kat bar, etc. So I'm going to assume we're talking about organic produce here. So really, there's not a lot of consistent research that organic products reduce cancer risk. In fact, As far as nutrient value goes, so vitamins, minerals, as well as our macronutrients, organic and conventional produce are going to have the exact same nutritional value. The other thing about organic produce is that, unlike supplements, our food is heavily regulated. So there are really strict guidelines for how much certain preservatives and chemicals that we use in the growing process that manufacturers can actually use. So they take a look at research and what they say is harmful to us. And if that limit is way up here, what's harmful, what we're allowed to have in our food system is way down here. With that being said, if you're just kind of thinking it through and you're just uncomfortable with, chemicals and certain growing methods in the food that you're eating, that is totally okay. You can absolutely, choose organic foods. Really, the research shows the biggest benefit to organic foods is more environmental at this point. If you can't afford organic foods, which many individuals can't, the most important thing is that you're still getting those plant foods in your diet, regardless of how it was grown and manufactured. So again, I know I get very wordy answering these questions. I just want you to have as much information. At the end of the day, with the organic foods, that's completely your choice. If you want a little bit of just, a feeling of security, then choosing organic might be appropriate for you.
Thank you, Savannah. We had a participant question. This is interesting, and I think one that a lot of people will have questions about too. But this is just recommendations around options. What would be some good options within like seafood, or maybe somebody that's like going for like a pescatarian kind of diet where they're going to eat shellfish and seafood. What would be sort of recommendations for healthy, maybe cancer-reducing options for that?
Yes, excellent. So when it comes to seafood, we have our fish, and then we have everything else, basically. So things like your oysters, your shrimp, clams, those kinds of things. So those seafoods are fine in moderation. They're a great source of protein, but they tend to also be linked to higher cholesterol. So having those, non-fish seafood in moderation is totally fine. Now, when it comes to fish, this is similar to the organic, where there is some inconsistent research. The consistent research that we do have is that fatty fish actually is anti-inflammatory. And in regions of the world, like the Mediterranean region of the world, where they consume a lot of fatty fish, they have lower rates of chronic disease, including heart disease and cancer. So we do recommend consuming fatty fish. The most available fatty fish in our food system is salmon. And then I believe herring is another, fatty fish that has those omega-3s that are so good for us. Other fish is fine as well. Things like tuna, a great source of protein and easy to come by. Cod, etc. Now, there are different levels of what fish you should choose based on mercury consumption. So some fish is shown to have higher rates of mercury. The highest fish, the fish that has the highest amount of mercury is going to be shark, king mackerel, swordfish. So to be honest, fish that I don't eat very often, and I rarely have patients who consume like shark regularly. So those are the ones that we recommend limiting or avoiding. But yeah, at this time, we're really recommending if you can incorporate salmon or another fatty fish 2 to 3 times a week, then that's a great intake.
Thank you. Awesome. Had another question about, this kind of goes back to talking about shakes. Sorry, smoothie. Sorry, excuse me. I need to make myself a smoothie. This person is asking, does a shake made with yogurt and fruit inhibit the absorption of nutrients from the fruit because it's blended with a dairy product? Is there any concern with like absorption when you have dairy? I don't know if that was clear, but that's the question. I think is about maybe blending ingredients and if that affects the way that they're sort of taken in by the body.
Yeah. Short answer, no. There's no concern there. You can absolutely blend dairy and fruits and vegetables. In fact, I would encourage you to have a smoothie that doesn't have to be dairy necessarily, but some sort of either a fat source or a protein source. That way, if you're just having a smoothie and it's just water, fruit, maybe some spinach, you're going to be hungry very shortly after that. So having some protein in there to help, build muscle, help with hormone function, help keep you full longer. Same thing with the dietary fat, having a healthy source of fat like some seeds or some nuts in there also provides great benefit. So there's no real concern with that. So go ahead, if you like your yogurt and your smoothie, go for it.
Thank you. I just had a clarification on the question about the discussion around the mercury levels in fish. Could you restate recommendations of limits on those, like for the high mercury? I heard you say shark, swordfish, and mackerel.
Yeah.
So what would sort of be like a safe amount, or is it really just to try to limit those just in general?
For those three that we just mentioned that are higher in mercury, really we're recommending avoiding them or limiting them completely. In general, one serving of fish is about the size of a deck of cards, or about 3 to 6 ounces. So if you are going to have a serving, limit it to that amount. But really, we're recommending just avoiding those few. And I just want to put an addendum. I'm kind of pulling that from my memory. I'm pretty confident that those are the 3 fish, but I can also double check that just to make sure I'm telling you the right ones.
I know swordfish is one of them because I decided only when we're on vacation and it's being caught locally is that something that we're allowed to have. I had a question from a participant that I thought was really good, and I want to just get this one in before we finish. But talking about reducing risk of breast cancer. So this is somebody that had breast cancer and really would like to do everything she can to reduce her risk of breast cancer. So you talked about weight loss, and you talked about eating a balanced diet. What are some is there anything else from a decreasing risk? Are there concrete specific things that she can do to really get some points for reducing risk and having that cancer not recur?
It's hard to say concrete, because when we're looking at research, in order for it to be concrete, there has to be a massive body of research, right? And it's so hard. We're not really looking at causation, we're looking at correlation, right? Because we're not making people obese and then seeing how their cancer risk is.
Right.
More specifically, just more generally, looking at your health holistically, taking a look at your sleep, your hydration, your physical activity, and your nutrition, as well as your stress levels. Trying to have all of those things in balance, I think would be really beneficial, even just from a quality of life standpoint. Making sure you're also getting more plant foods from things like herbs, not dietary, not supplement herbs, but herbs that you're putting in your cooking, spices, seasonings. Incorporating things like flax seeds and chia seeds. There's great research there. Having moderate amounts of herbal teas can be helpful in just getting exposure to more plant phytonutrients. So those are just some extra key points that I can give you.
Thank you so much. That's helpful. And I think we are getting close to our time, but I have one more question, and that is about supplements. This is someone asking, who should I be talking to about supplements? Is that my oncologist? Is that my general practitioner? Is that somebody an additional, doctor that I can see to talk to about that? Well, who are sort of the people that would be important to, talk about supplements with?
I would say if you have an oncologist, certainly bring up your supplements. Some oncologists say, okay, tell me everything the first time I meet you. I want to know it all. Some, depending on what you're talking about, that might slip to the back. So you might want to bring that up and be like, hey, I just want to show you my supplements. I want to tell you what I'm taking. Do you have any thoughts? So certainly your oncologist. And the reason why I want you to talk to them is because if you are taking any medications for cancer treatment, some of them are actually contraindicated with certain dietary supplements. So certain treatments, I'll see that there's like antioxidant supplements that can actually make the cancer treatment not work very well. So we would want to know that, and we want to tell you to kind of cease that altogether. Now, if you don't have an oncologist, certainly you can bring it up with your general practitioner or your primary care physician. They can also help you determine, what might be excessive versus what might be helpful.
Okay. Thanks. Yeah, thank you. I think that conversation, can be an ongoing one too, right? Like it's just, I think, important to just be in the habit of, if you start taking something new, to just check in, or before you begin taking it, just clear it with them, because there are some meds, as you said, there's some, chemo regimens that can be affected by, free radicals, or, things that might be causing, be in a supplement, or be reducing, the number of free radicals to something that somebody may be taking with chemo. So, well, this is super helpful. I feel like we could go on and on. I think we got to all of the questions. I'm going to invite Katie back and just make sure. Something happened with my internet, so I got kicked off at one point. So I'm sorry to miss a little bit of the conversation, but I wanted to invite Katie back on to wrap us up, and just to thank Savannah for this great presentation. I think just it's a conversation that I think we all need to have on a regular basis, and the information is so helpful. Really appreciate your time and your expertise.
It's my pleasure. Thank you guys so much for having me and for tuning in on your lunch hour, everybody. I'm so happy to talk to you guys about this. So if there's any way that I can help anyone in the future, feel free to reach out to CSC. They can put us in contact, and I'm happy to assist further.
Perfect.
Thank you both, Emily and Savannah. Thank you, Emily, for moderating all 3 parts of this series. I think we had some great Q&A for each piece. Savannah, thank you so much. And thank you to Tim and Kiana for the 2 previous presentations as well. If you know anybody who missed any portion of the series, or if you missed any portion, we invite you to visit our video library, where you'll be able to find all 3 of these installments shortly. And we will also be sending an email out to everybody who registered with the recordings as well. And again, we invite you to visit cscatlanta.org, where you can find a complete list of the virtual and in-person oncology support programs offered at no cost. So thank you, Savannah, and thank you again, Emily, and we hope everybody takes care, and we hope to see you soon. Bye-bye.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.